at Maharashtra now, one of the most impacted states with COVID-19. Now, the Health Minister of Maharashtra, while he was on a video conference with the Health Minister at the centre, Dr. Vardhan, requested the centre to take out notification to let neighbouring states provide oxygen to Maharashtra. Now, Maharashtra is facing an acute oxygen shortage and its neighbouring states can give it oxygen as well at this point, should help in it. In fact, Aditya Thackeray also tweeted about it, saying that he held a detailed review meeting with the city suburban collectors, municipal commissioners and for COVID response. And he said that while they are seeing an exponential rise in COVID deaths and cases and hospitalization, the second wave is much stronger than the first. And while test and tracing, communication, all of that is running on autopilot, what they're struggling with is bed capacity, which they've also managed to increase to about 23,000 beds. And they need now, what they really need is enough oxygenated beds. And where they are seeing an exponential rise, really, people being admitted more and more on ICU beds over there in Maharashtra. Let's go across to Saurabh Gupta now, joining us for the very latest. Saurabh, no good news this morning, really, when it comes to numbers. And Maharashtra really struggling now. It is the oxygen beds as well. Yesterday we did a story on how there was a lack of blood as well. What exactly is the situation and who can step in? When Maharashtra says they need help from neighbouring states, what exactly are they asking for?
Well, you know, if you ask for the key thing that Maharashtra and specifically Mumbai is asking for is please open up the vaccination for everybody. In this second wave, what you're seeing is younger people are the spreaders. Younger people who haven't been vaccinated, who are going out, who are carrying the infection from place to place. So the key thing is and you know, this is something the Chief Minister has written in a letter to the Prime Minister, that please bring down the age of those who can be vaccinated so that the primary spreaders of the infection can be vaccinated. And that is key to tackling this wave of COVID in Maharashtra, because at this point the focus is on vaccination. Now, apart from that, what can we do? Well, of course, increasing bed capacity. Oxygen is something that's important. Blood supply in blood banks is falling short. So increasing bed capacity can be done exponentially. But what you can't do exponentially in terms of increasing is healthcare staff and healthcare workers. Now, what the government is saying and what we've been reporting yesterday, in fact, we were at a COVID center yesterday, Seven Hills Hospital, where the dean there, Dr. Balakrishna Adsul, told us that, you know, they will have, once the final exams end this year, at the end of this month, they will have around 1,200 doctors joining, you know, several hospitals. These will be fresh pass outs. So they will also then, of course, you know, that'll help them in increase the capacity. But given the numbers we are seeing in the second wave, and it's much more, you know, sort of hard hitting in terms of the healthcare system, that the key is vaccination, and vaccinations need to be opened up and increased to more people, especially lower age groups who are the primary spreaders.